Hi, my name is Alan Unell, and this series of videos is called Healthcare Reform Advocacy. Each video addresses a problem in the healthcare system and has an action we can all take to make the system better for all of us. Today I want to talk about money and healthcare. Currently, the U.S. pays more per person for healthcare than anywhere else in the world, $12,555 for each of us. And frankly, not each of us gets health care. There's about 29 million of us who have no health insurance, about another 75 million who have insurance, but they don't use it because they have high deductible emergency policies. The deductibles are so high, it's only in the event of a crisis that they'll use it. The Organization of Economic Cooperation and Development keeps track of healthcare costs around the world. There are 35 peer industrialized nations, they're peers to us, and they all have universal health care. And there are countries like Switzerland and Japan and Germany and Austria. And let me share with you, Switzerland is the most expensive after the US, and they're $8,000 per person, except that they really do cover everybody. There's going to be a link in the description below to the Healthcare Advocacy newsletter, and if you want, you can go get the OECD report there. Well, in 2020, the Nonpartisan Congressional Budget Office, who models costs and legislative effects for everything Congress can possibly imagine, was asked to look at universal health care. And they found that by covering everybody in the United States, we could save a fortune, that it would be far cheaper than we as a country spend now. Here were the savings they found. $400 billion in yearly savings due to excess overhead. Another $200 billion savings in pharmacy costs. That's 15% of our national cost for healthcare. And it would cover everybody. Everybody gets to go to the doctor. So I've been rooting around looking at insurance companies and how they make money, and I discovered that there are more savings potentially to be had. ProPublica did an investigation a few weeks ago, and here's the situation. Medical providers like to be paid for their services as soon as possible. A lot of us like that. I used to be an aerospace engineer, and I used to like to have my paycheck automatically deposited in my bank account. I got to use the money right away. No going to the bank, no waiting for checks to clear. My employer liked it too because it was cheaper for them to deposit the check automatically than it was for them to issue me a paper check. Now, up until 2017, there was a government healthcare insurance regulation in place that precluded insurance companies from charging a service fee when they paid health insurance claims electronically. Mysteriously, in 2017, the rule disappeared from the government website. Backdoor shenanigans got people in the Trump administration to remove the rule. And now insurance companies, get this, they deduct 1.5% to 5% from the payments they make to healthcare providers. What a scam. It costs less for them to transfer the money electronically than writing a check, but they're going to charge for the privilege. That's precisely what's happening. Almost 60% of medical practices have said that they were compelled to pay fees for electronic payment at least some of the time, according to a 2021 survey, and the frequency has increased since then, according to medical clinics. Now listen, more than $2 trillion in medical claims are paid electronically every year. These fees are likely adding up to tens of billions of dollars annually. The shift from paper to electronic processing, which began in the early 2000s, and it did accelerate during the Affordable Care Act when that went into effect, was intended to increase efficiency and save money, and it does. The story of how a cost-saving initiative ended up benefiting private insurers reveals a lot about what's wrong in the U.S. healthcare system, and why Americans pay more for health care than people in other developed countries. In this case, it took less than a decade for a new industry of middlemen owned by private equity funds and giant conglomerates like United Health Group to cash in. and they are cashing in. Okay, I spent some time going through government websites because CMS, the Center for Medicare and Medicaid Services, they like to have claim forms submitted electronically, and they like to make electronic fund payments when they pay their claims. Guess what? They don't charge. Okay, universal health care covers more people for less, cradle to grave. It eliminates cheating everywhere. It doesn't charge to make payments to providers. It is public insurance paying private providers. Let's remind our representatives that that's what we want them to do for us. So here's the action. It's an easy one. On your cell phone, you can send a text message to 50409 and just type in SIGN, SIGN, and then the letters PEZDQK. And an email will go to your congressperson and both your senators and to the president telling them, cut it out. Just cut it out. We're wasting money and giving it away to the insurance companies and having less money to spend on health care for all of us. We want you to cover all of us, cradle to grave, pass universal health care for all of us. Have a great day. All the data is going to be in the description below, together with the links. I'll include a link to Healthcare Advocacy if you'd care to see all of our articles. You can also subscribe there, like, share. Have a great day.